So clinical manifestations of Reyes syndrome, there is hepatic encephalopathy and brain edema. That's the main thing. There are 5 stages of clinical picture. Stage 1, 2, 3, 4, 5. Stage 1, the child is quiet, sleepy, vomiting, agitated, no, vomiting, anorexia and apathy. So like the child is sleepy and quiet. Sometimes it does not want to eat, anorexia. Sometimes it vomits, vomiting, and then apathy. Okay, so like கண்டுக்காம இருக்கும் அப்படியே. And then lethargic. That is stage 1. Stage 2 ல deep lethargy, and then அங்க வந்து காமா இருந்த child அப்படியே sleepy அந்த child இங்க வந்து it gets delirium, agitated, restless and hyperventilation இருக்கும். All these are seen in stage 2. In stage 3 there will be light coma and decorticate rigidity. Okay, light coma and decorticate rigidity. Stage 4 la deepening coma and decerebrate rigidity, and along with that seizures can occur in stage 4. In stage 5 there is deep coma, flaccidity, there's no rigidity. Okay, 3 4 la rigidity இருந்தது, 5 la flaccidity, அப்படியே ஒரு ஒரு வாழைப்பழ தோல் மாதிரி இருக்கும், flaccidity, and then loss of reflexes and respiratory arrest. All these are the stages of hepatic encephalopathy with brain edema. Jaundice is infrequent in Reyes syndrome because the bilirubin is not raised, and only if the bilirubin is raised, jaundice occurs. But இங்க வந்து அது நடக்காது. Laboratory findings of Reyes syndrome: low glucose, low CSF glucose. Low glucose in the blood is called hypoglycemia. Low glucose in the CSF is called hypoglycoria. Hypoglycoria. Okay. PT is elevated, ALT, AST is elevated, ammonia is also elevated. AST is elevated 3 times more than the normal. Okay, yeah. So what are all elevated? ALT, AST, PT, ammonia. All these are elevated. ALP, that is alkaline phosphatase, is normal. BR, that is bilirubin, is also normal. Explains why jaundice is not there. Other metabolic problem, the acid-base imbalance on the RALK and MAC, which is like Apple computer. Metabolic acidosis will be there, and RALK, which is respiratory alkalosis, will be there. RALK and MAC is seen in Reyes syndrome. On a liver biopsy, we can see microvesicular fatty changes, absence of inflammation, and then depleted glycogen stores. So like glycogen is not there, but fat is there, but there is no inflammation. In the kidney, there is swelling and fatty infiltration of the PCT, which is a proximal convoluted tubule. Okay, so this is about the Reyes syndrome. So from the beginning, Reyes syndrome is a mitochondrial disorder. It's characterized by 3 things: encephalopathy, fatty infiltration of the liver, fatty infiltration of the kidney. So it's otherwise called encephalopathy with fatty infiltration of the viscera. It's a self-limiting metabolic insult. Basically, the problem is inhibition of fatty acid oxidation. It could be because of virus, it could be because of aspirin. There are 5 clinical stages: stage 1, 2, 3, 4, 5. Seizures occur in stage 4. Deep coma occurs in stage 5. Jaundice is absent. Laboratory features are increased AST, ALT, PT and ammonia, normal alkaline phosphatase and bilirubin, hypoglycemia, hypoglycoria, and MAC and RALK. And apart from that, biopsy will show microvesicular fatty infiltration of the liver, absence of inflammation in the liver, and depleted glycogen stores in the liver. And in the kidney, there is infiltration of the fat, swelling and fatty degeneration, the proximal convoluted tubule. So that's about the Reyes syndrome. The next video, let's see about hydranencephaly. But like, okay, that's enough. Thank you.